Hi, everyone, and thank you for taking the time to join us. This occasion is the beginning of an important dialogue, a monthly touchpoint for us to communicate, clarify, and commit. The fabric of Oracle has always been woven with threads of innovation, vision, and an unwavering commitment to the industries we serve. In a similar fashion, Cerner has dedicated over 40 years to improving healthcare for clinicians, patients, and the entire ecosystem. Yet vision alone doesn't sustain a company. It's the execution of that vision, the way we respond to challenges, and our interaction with those we serve, you, our valued customers, that truly defines us. While we carry a profound vision for the future of healthcare, we are acutely aware of the importance of the present. As we work towards revolutionary breakthroughs for tomorrow, we remain grounded in the immediate needs and concerns that each of you are struggling with. Every journey sees its shares of bumps and challenges. However, what defines us is not the challenges themselves, but how we respond to them. We've always believed that constructive feedback is a gift, and we've received plenty from you. For that, we are very thankful. In any competitive landscape, there's a mix of information, some accurate, some embellished. We're aware of the narratives that some of our competitors are promoting. We believe that our actions, our solutions, and our continuous engagement with you will speak louder than any narrative. We believe thinking about competitors is the wrong lens for this massive work ahead of us to change the healthcare landscape. We want to collaborate. We want to be open. It's vital to reiterate that Oracle Health has a unique market position to offer true interoperability and flexibility that health systems demand. We've witnessed the transformative power of our suites across all the industries that we serve, and we're committed to further harnessing this for the benefit of healthcare systems everywhere. This brings me to the core of why we're here today. This monthly webinar series is our commitment to transparency and accountability. Each month, we'll discuss the immediate advancements, improvements, and changes we're implementing based on your feedback. Our aim is just not to tell you what we're doing, but to show you in real time how we're translating your feedback into tangible results. Our promise to you is twofold. First, we're committed to continuously refining our current solutions, ensuring they remain relevant, effective, and responsive. Second, we pledge to keep pushing the boundaries of innovation, creating solutions that anticipate and address future challenges in the healthcare landscape. As we embark on this monthly journey together, I want to emphasize that this isn't a one-way street. We're eager to hear from you. We want your feedback, your critiques, your insights, and your aspirations. In closing, let me say this. Our past has shaped us. Our present is refining us. But our vision for the future is what truly drives us. We're here, standing shoulder to shoulder with you, ready to move forward. We appreciate your faith, your patience, and your partnership. Together, we will continue to shape a better future for healthcare. Thank you for joining us today. I am now pleased to hand off to the Executive Director of the Oracle Health Foundation, Shauna Adamic, who is joined by EVP of Software for Development for Healthcare, Mark Levy. Let's begin this dialogue.
Well, thank you so much, Mike. I am very excited to be here today and having this conversation that is rooted in transparency and accountability, something that we're going to focus just a bit on the past, the steps we're going to take right now in our present, and where we're headed in the future as we shape healthcare together. And I am so excited to be sitting here with Mark. So thank you so much for having this conversation with us today.
You're very welcome, and I'm happy to be here talking to you and to our customers.
Wonderful. Well, thank you. And we have a lot to talk about, so I'm going to dive right in. But let's start with something that I know we both agree on. We are standing shoulder to shoulder with our customers right now, and we are ready for this future of healthcare. So can you talk to me a little bit about the journey that we've been on in refining the products based on feedback?
We've heard very, very loudly that our customers need us to address the present. They have issues today, and while they're very interested in the future, they want to make sure that we can get there together. So that's one theme. The other one is that, and it's especially true because of the really technological breakthrough that as an industry we've seen for example, with generative AI, that they're also expecting us to deliver genuine innovation that also they can adopt incrementally. So those are some of the really big themes that have emerged for us, in the year plus since the acquisition. Now, let me start by talking about what we've been doing to date. So the first thing is that we've done an enormous amount of what I would call foundational work. So for example, we have fixed a number of architectural issues with the system. We have fixed hangs and crashes to improve the experience of the system by our users. We've improved our ability to deliver update. And the impact of that, and we'll talk about this perhaps in somewhat more detail, has been a more reliable and performant system, and also now an ability for us to be able to deliver more frequent fixes and feature functions.
Feedback anytime is a gift, and Oracle Health is taking this very seriously as we head into this shift in healthcare together. User experience is important. Really being focused on that critical issue of provider burnout is important. And so we're addressing these problems and we're resolving them.
So with respect to the now, what we've done is through very extensive conversation with customer and analysis of the problems reported by our users, we have identified top pain points for our customers, and we'll be addressing those over the next 4 quarters. Example of those problems include enhancement to the problem list, MedRec, documentation. So for those, we are solving for getting these in the hands of our customer as soon as possible. To the other part of your question, we have absolutely heard very loud and clear about provider burnout. And I think it's one of the themes that we're really going to try to address. Now, of course, fixing bugs and addressing pain point is an aspect of that, but only a fairly small one. So there are things that we are doing, leaning into the future, that go into that direction also. Two example area are documentation. So the fact that physicians very often have to pick up at home the task of completing documentation of encounters that they've had during the day. And this is definitely a big factor with respect to burnout. It's what they call, I guess, pajama times. And then another example is the very high volume of messages that they need to process in Message Center. So that's an example of another area where we're going to do things that are more forward-looking and introduce what we sometimes call our next-gen experiences. So for that, we've created what we call the Clinical Digital Assistant that is now in beta, and that help really automate the documentation by participating in physician-patient encounters. And this is literally in beta right now with a couple of customers. We just started it. So I guess what you can see is that we're going to apply a mix of approach to actually respond to the feedback that we've gotten with customer. Some things are going to be tactical very, very soon. Other things are going to be quite soon, but more radical in terms of the approach. And we really think that this kind of combined approach is the right one. And when we've spoken about this path to our customer, I think it really resonates. Now, as Mike was saying in his introductory remark, this business is 10% about ideas and 90% about execution. So we really want our customers to hold us accountable to the promise that we are making, including the stuff that we talk about in these webinars.
Thank you for that. It's really encouraging to see, we're taking care of these pain points, but we're also thinking of the future. Digital AI is an example of that, and what we can do in this next chapter as we head into healthcare. Well, I want to focus on one piece, and that's code defects. And I want to hone in on, since we've acquired Cerner in June of 2022, can you give me an idea of a number, just perspective on how many of these code defects have we addressed, successfully addressed?
Yes. We as a developer, right, we in general, we want to work, of course, on the new stuff, feature function, and the rest of that. But the reality is that we're spending a significant amount of effort in really taking care of what we have, and and one big part of that is fixing code defects. So on the bug front, we fixed roughly 8,000 client-reported bugs across all of our products since the acquisition. About 3,000 of those are in clinical and the continuum area. Now, the other thing that we've done as well is that we've also fixed many defects from improvement process, and maybe we can talk about that in a bit as well. So for example, we use lights on to identify hangs and crashes and fix them. So as an example, for the federal client, we've seen a 35% reduction in user interruption. And what that means is really the time when users have to wait for a long time for an action that they perform to complete crashes is self-explanatory. And of course, when we fix them for a client, all of those fixes accrue to all of our customer bases, including the commercial customers. The other thing that we've done as well is that improved our testing processes, and that has had the impact of reducing the number of defects that escape in production. There we've seen actually a 30% reduction in the rate of incoming customer-reported defects. So I think good progress. We're nowhere near where we want to be, but in this situation, I think what's important is also the trajectory, and I think there is absolutely no doubt that the trajectory is positive, and we're receiving actually on the front of reliability of the system, good feedback from our customers.
That's great. We're taking steps, and there's a concentration on this, which is terrific to be able to see. And what's the benefit of resolving these code defects for the clinicians?
It's twofold. First of all, with respect to what we call, again, these user interruption, is not having to sit there and wait for a very long time for the result of your action to occur. So this kind of frustration that we can all relate to, right? When I know it even with my phone or my laptop. When you try to do something and you've got the little hourglass going and going and going. So that I think is making the system just more effective to use and less a source of frustration. Now again, the good part is that the system has very good telemetry, right? So we are able to consume a lot of data that gives us excellent visibility into the experience of the users of the system. And the improvement that I'm talking about are really, it's a sort of a chipping away process, right? So it's the work of kind of grit and persistence.
I absolutely believe that. And we do have grit and we are persistent. And, it's not just with code defects. Let's talk about another piece. There's another element here, and that is the barrier that's caused by downtime. That is a barrier to providing timely care. And so can you talk to me about how we're ensuring reduction in this space?
When we've had an incident, it's not only that incident that is not going to occur again, but incidents like it are also going to be addressed or mitigated, at least the probability that they might occur is going to be reduced through the action that we take. I mentioned that beyond fixing code defects, we've made also architectural improvements and really fixed some deeper architectural issues with the system to achieve better reliability, availability, better performance of the system as well.
The next area I kind of want to hone in on it right now is this shift to Oracle Cloud infrastructure. This is important. We know this shift promises scalability, reliability, and enhanced security. So talk to me a bit about the progress we are making in the migration and to this cloud-based platform.
Yes. So when I talk to customers about this, I often get the question of why OCI? And first, just a quick definition. OCI is infrastructure in the cloud. So very simply put, it means that you have compute, storage, networking, and so on offered in the cloud. So what's good about that? As you said, it's more reliable, it's more scalable, it's more performant, it's always up to date, it's more secure, it's more compliant. But also, and this is really important, it is API driven. The upshot of that, the impact of that, is that it's much better suited for automation of the life cycle of customer environment. So for example, when we first provisioning environment, you can do this much more quickly. When you need to scale it, you can do it much more quickly. When you need to react to incident, you can do this much more quickly because you can build automation for that. The other thing I would say to this playbook is something that we've done across the entire Oracle application portfolio. So we have a lot of experience with that, including my team that we're bringing to doing this for the EHR.
So, let's hit on a final point, and that's something that Mike touched on, and that's interoperability. We are uniquely positioned in this space. Can you talk a little bit more about that? And what is the role our partners play in this health ecosystem?
Healthcare is an ecosystem, right? Patients don't belong to a particular healthcare provider. I mean, if anything, they belong to maybe the payer. So it's an ecosystem. So you have to consume data from many, many places, and there are many systems that participate in delivering the care experience. So we're investing very heavily in open APIs, in interop, and in integration. Now let me just elaborate a little bit on what I mean by these three different things. So the first thing is that part of our approach to improving and modernizing the EHR is open API. So all of the work that I described earlier as its foundation, open API. So we are using these open API ourselves to deliver the new healthcare experience, and those API are available to our customers if they want to extend or customize the system, or to partner, be their ISVs or value-added companies that can provide additional pieces that can use the platform that we're building. So that's for open APIs. Then from an interop standpoint, and by that I mean, how do we automate the exchange of data between all of the players in the ecosystem? We're investing very heavily there. So a good example of that is seamless exchange that we GA'd earlier in the year, and that is now deployed at several of our customers to excellent feedback. And then finally, integration. This is sort of within the four walls of the provider. There we have actually a lot of interesting Oracle assets there. For example, the ERP systems such as Fusion. And there we're starting by creating data warehouse that combine data from both the EHR and the ERP, so that you can have much more interesting analytics that the business can use to operate more efficiently, deliver better care, etc.
Well, thank you so much, Mark. This has been such an inspiring conversation that, again, has been rooted in transparency and accountability based on feedback. And to use some of the words that you used during our conversation, it's really taking those small steps. It's grit, it's resilience. We've embraced this moment, and we're not there quite yet, but we're going to get there. And I hear the optimism in your voice. So thank you to you and your entire team for everything that you're doing and everything that you're going to do to get us into this next chapter. It really is the past that has shaped us, the present that is refining us, and the vision of this future that is driving us forward. We're going to get there. We're making a monumental shift in healthcare.
Hi, I'm Geneva Haynes, Senior Director for Product Management of our Patient Accounting and Contract Management product portfolio at Oracle Health. I'm thrilled to have an opportunity to share with you what we have been working on as we have brought RevElate Patient Accounting to market. I will be sharing a brief overview with you today, and then we'll transition into it. We have a great opportunity to see a demo. With revenue cycle, we continue to see a lot of pressure for customers to manage their reduced margins, increasing costs, mergers and acquisitions and the change that surrounds that, and then also the evolving regulatory standards. Not to mention the labor changes and evolution to the remote workforce. As a result of these challenges, and industry dynamics and trends, customers are seeking better information, automation that they can use to more easily handle change over time. Customers have reinforced the need for products that promote accuracy, timeliness, and automation in their billing processes to optimize their operational profitability. RevElate is uniquely positioned to deliver a differentiated, clinically integrated revenue cycle workflow with native automation capabilities that drive network-level financial outcomes. We've brought forward and lifted capabilities from Sorian Financials and with a fully integrated implementation with RevElate. This brings forward a flexible data model that allows for you to manage your business across acute and ambulatory settings. With automated linking rules, we enable you to treat the patient as a clinical encounter occurs without having to worry about how it needs to be billed. Instead, we use automated charge grouping or splitting rules to create the claim or claims off of that clinical encounter. Add to that payer rules that embed payer edits and push them upstream, alongside the capability to automate the reimbursement calculation of that claim. Ultimately, as I work AR, I'm managing with a workflow-centric solution that has both automation rules and work queues for those exceptions, as well as a user experience and dashboard that helps me manage specific billing workflows. Last but not least, we have the tooling to measure the success of everything to the left and bring forward financial outcomes. Each of these capabilities that I've discussed were brought forward from Sorian Financials. Let's talk about what we've seen in terms of success with those capabilities that I've outlined. Across both RevElate and Sorian, we have around 80 customers live today. I stress that because I want to make sure we understand it's not a new solution. However, it's a new implementation with additional capabilities that we've brought forward as RevElate. This allows for us to uniquely drive clinical integration and bring forward those outcomes for a broader set of clients. There's a large volume of billing data going through the system today with commendable operational metrics at these clients. When you think about the implementation of RevElate, we have many clients who are on that path today. Most notably, we have Baycare, who went live across their enterprise in 2023. They brought forward the new capabilities of service-based integration and clinically integrated business rules to drive that deep clinical integration. Charleston Area Medical Center is in their final stages of testing with their first 4 facilities. And as they've grown and evolved into Vandalia Health, they'll look to bring those additional facilities live as well. When we think about advancing the clinically driven revenue cycle, we are still driving towards that same vision we've had for decades around building a foundation, connecting clinical and financial workflows. Using the registration and scheduling data, much of which is directly provided by the consumer, alongside relevant clinical data and documentation informing the patient status and services provided in near real time, all driving to a single reporting and a data analytics strategy. We'll also be advancing the connected ecosystem with open APIs. This is exciting. This is different. Instead of having a fixed number of claims, we have APIs embedded, allowing any system to drive workflow queues, and we're not waiting for batch jobs to run on a nightly basis. We can advance and take that opportunity for real-time data. As we transition to the demo, you will see us highlight a few key areas of strength within RevElate. These capabilities are core to the success of our customers as RevElate drives accuracy, timeliness, and automation within their billing processes to optimize operational profitability. Now I'll hand it off to you, Cindy.
Thank you, Geneva, for the context of RevElate. Let's go ahead and show your organization how RevElate can work for you. Now, RevElate's homepage is tailored to each user, putting the work list and the tools that they need at their fingertips based on their role and to enhance productivity. Now, it's broken out into different quadrants by tasks and work list. Now, tasks are where you put that day-to-day tools that users are going to access every day, such as launching out to reporting or a payer website or even a third-party application. Standard work lists are encounter-based actions like reviewing a payment or charge errors. Enhanced work lists, those are configurable exception-based queues that route work to a specific user at the right time in the workflow for correction. Now, items that cannot be resolved through an automated rule, they would populate here for review. One of our most common work lists is within our pre-bill edits. Now, RevElate automates repetitive editing against embedded payer content as early as the first charge posts. Now, this leads to a higher degree of accuracy, improving your first pass clean claim rates, reducing denials, and lowering preventable rebill frequencies. And our open strategy allows for your organization to connect with third-party vendors that best meet your needs in your area and your specialty. Now, looking at a patient account of Samantha, RevElate supports billing management across your entire organization, presenting you with all patient account activity in one place. Our event-based rules engine can drive billing rules to manage business needs, such as linking rules that group activities from one clinical encounter while splitting out the charge groups across sub-encounters according to the payer billing requirements. Now, RevElate is vendor-agnostic billing system, so charges are captured no matter where they are generated. When utilizing the Oracle EHR, charges are built and maintained in one consolidated charge master, and they post directly into RevElate. All the charges are reflected in the patient account, and editing begins in near real time as the charges come in from the visit for more accurate data capture. Now, looking towards how we are streamlining workflows, let's review how we are managing payer contracts. The contract management engine mitigates the use of interfaces while using payer intelligence and improved automation rules to calculate expected reimbursement at the time charges are posted pre-claim generation, automating the posting of expected contractual adjustments and drive variance resolution to help your organization focus on timely and accurate accounts receivable postings. Now, leading practice payment variance tools include business rules and work lists to drive follow-up and underpayment recovery. Native tools, they give you an intuitive way to build out complex production and even model contracts to actively manage reimbursement and financial impacts according to those payer term agreements. Now, this is an active production contract with Cigna, and it has visibility into all of the rate sheet packages and terms. Expected reimbursement calculation begins at the time a charge is generated and will continue to update until that adjustment transaction is set to post. Contractual adjustment timers define when the transaction is posted, and it's going to be reflected on the AR per the contract package. Now, the timing options for posting are at discharge, at the time of bill, or at the time the remittance is received, regardless of when the adjustment is taken. Expected reimbursement is calculated and reportable to provide better insight into the true value of your AR. Now, qualifications and rate types, those are configurable to meet your needs from your complex contracts, as well as to incorporate stop loss and exclusion calculations. Now, from here, the appropriate rate types, those are easily applied and they're flexed accordingly to capture the proper reimbursement. Now, let's see how RevElate facilitates these contract changes and the variances. Now, when payment and adjustment transactions are received from the payer, if there is a payment variance between what was expected and what was received, it'll be sent to staff for review. Now, this work list presents face-up charge, reimbursement, and variance details to help the user be efficient in determining the next step. Now, in reviewing the reimbursement calculations to identify how the expected amount was calculated, the user finds that the last time the reimbursement was calculated, it qualified for some exclusions. Now, this exclusion is set to reimburse at 40% of the cover charge amount. When changes are made to the contract, the health plan, or when a late charge is applied, the expected reimbursement recalculates, resolving the variance and removing it from the work list. Additionally, through dynamic post-remittance rules, you're able to determine when to write off or to transfer balances based on the contract terms, the packages, the dollar amounts, and more. Now, moving on, we're going to take a look at our remittances. RevElate enables 835 remittance processing rules where reason and remark codes can be tailored to your health plans and your contract terms in order to appropriately post payments, adjustments, balance transfers, and even denials. Now, remittance processing rules accommodate claim and even line level posting with the ability to match the line level transactions to the correct claim lines through configurable rules. 835 remittances, they can be automatically posted or come to a work list for review, which we'll take a look at later. As cash posters begin their day, they'll have visibility into the electronic 835 remittances that have been received and are waiting for review and posting. At a glance, the user can see that there is a remittance from Cigna and begins to review the claims in detail to ensure transactions are going to post correctly. Starting with the remittance summary, the user is going to see any type of fund transfer details, the deposit date, the transactions that were sent on the remittance, and they can compare the balances to ensure that they match appropriately. For further analysis, the user launches into the transaction details included in the batch. Now, this claim, it has multiple line items, and the user is going to review the posting of each line. One line has been denied and will be routed to the denial management queue for review, while the other line has been paid with a contractual adjustment and the copay amount's going to be transferred to the next responsible party. Now, once the cash poster's review is complete and everything is set to post and balance correctly, they can go ahead and post the batch and it will be reflected on each account. So now that we've talked about the remittance posting and driving activity based on remittance responses from the payer, let's go ahead and take a look at how we're able to work denials. Now, RevElate has an inherent denial management system that makes inevitable denials really easy to identify. Based off of payer intelligence, take automated corrective action based on payer rules. Now, your organization is able to define smart flows around frequent payer denials and resolutions to automate actions without any user intervention. For example, if you know that 9 times out of 10, the user is going to rebill the claim and it's going to get paid, a smart flow can actually be set up to take the action a user would typically take, adding the appeal, rebilling the claim, changing the status to appealed. Now, this can all be set up to happen with no user analysis or intervention, allowing your staff to dedicate their time to more complex, higher value denials within your organization. Now, when a denial requires user intervention, it's going to be assigned to a user using payer-specific insurance transaction level logic to prioritize unpaid claims. The root cause and recovered amount tracking results in being able to track trends associated with payers and work towards decreasing those AR days. Now, by reading the details easily seen on the work list, the user identifies what actions need to be taken on the denial, whether that be a claim or a claim line level denial that needs to be resolved. Now, after further review, it is clear that an appeal needs to be sent. The expected reimbursement tied to this claim is reviewed, as well as the amount that will be recovered with the appeal. The root cause of the denial is documented, denoting the true reason behind the denial, separate from what came in on the remittance. Now, reporting is going to analyze denial types. That's going to help your organization make informed decisions on the denial and payer trends, identifying automated rules and implementing new processes for your staff. Now, from here, the appeal is added along with the appeal level and the status. Then an appeal letter is also able to be generated. The appeal letters are going to flex based off of what your payers require. Now here, the letter can be sent electronically without the need to print or fax any of that information. The appeal letter is stored for reference later if needed. Again, through smart flows, this entire workflow can be automated, enabling your users to focus on more complex denials. Now, with RevElate across many markets, I'm truly excited to watch more of our customers realize the benefits of this incredible new offering. Now, to wrap up this first episode of Inside Access, I'll hand it back to you, Mike.
Thank you, Geneva and Cindy, for the update on the progress we've made on RevElate. And thanks to everyone who participated in the event. I cannot overstate how important this series is to all of us. Transparent, honest, open. These characteristics are core to who we are and what we want to bring to the industry. That brings our time this month to an end. I hope you'll join us for our next webcast on December 5th. Have a great rest of your day.